So I'm going to start my lecture, okay? So there are two important systemic diseases which are related to eye. One is called hypertension and the other one is vitamin A deficiency and its effects on eyes. Now, how will you define hypertension? It is a medical condition, long-term medical condition in which the blood pressure is persistently raised in the arteries. And how will you define hypertensive retinopathy? It is a retinal vascular damage caused by hypertension. Damage to the retinal vascular tree. Now, every hypertensive patient does not develop retinopathy. There are certain risk factors, and these include prolonged high blood pressure, heart disease, atherosclerosis, diabetes, smoking, high cholesterol, overweight, and eating unhealthy diet. So these are the important risk factors which lead to the development of hypertensive retinopathy. Now, how hypertensive retinopathy develops in a person with history of hypertension. So when the blood pressure is too high, the retinal blood vessels, the walls of the retinal blood vessels, they thickened. Once these blood vessels are thickened, the lumen becomes narrowed. When the lumen is narrowed, blood vessels restrict blood from reaching the retina, and when the less amount of blood reaches the retina, it gives rise to retinal ischemia or hypoxia. This retinal ischemia causes increased vascular permeability. Now, this increased vascular permeability gives rise to hemorrhages, soft and hard exudates, retinal edema, and the optic disc edema. And all these features of hypertensive retinopathy, they cause loss of vision. Next, classification of hypertensive retinopathy. It is divided into 4 grades according to severity of hypertensive retinopathy. Grade 1. In this grade, there is simply narrowing of the retinal arterioles. This is called vascular attenuation. In this photograph, fundus photograph, you can see clearly narrowing of the retinal arteries. Here you can see retinal artery is very much narrowed, almost gone. Just a faint line you can see. This is retinal arterial attenuation. Also, you can see in this photograph, here the retinal artery can be seen clearly, but at this point, it's thin like a thread. So this is attenuation of retinal arteriole. Grade 2. There are 3 features in grade 2. Number 1, all signs of grade 1, that is retinal arterial attenuation, plus irregularly located tight arteriolar constrictions known as arteriovenous nicking or AV nipping. Arteriovenous nicking or AV nipping. These are tight arteriolar constrictions, irregularly located. And the third feature is Salus sign. Salus sign means deflection of veins at the arteriovenous crossing. Now just know what is AV nipping and what is Salus sign. Now this is AV nipping. Now if you can see in this diagram, you can see the vein has been compressed by a small thickened artery. This is the vein and this is the artery. Now you can see vein has been compressed by a small thickened artery, and this is called arteriovenous nipping. And the second feature is Salus sign. Salus sign means deflection of veins at the arteriovenous crossing. Now, deflection of vein at the arteriovenous crossing. Venule crosses the arteriole in a horseshoe shape. Grade 3. There are 5 features of grade 3. Number 1, signs of all grade 2. Then copper wiring of arteries, Bonnet sign, Gunn sign, and retinal edema, Conjunctival spots, and flame hemorrhages. These are the 5 features of grade 3. Now take one by one. Copper wire reflex. What is copper wire reflex? When the transparent arterial wall becomes thick and reflects light, the reflex looks like wider and burnished copper colored. Here you can see this is the retinal artery. It reflects light which appears burnished copper colored. This is. Next sign is Bonnet sign. Bonnet sign means banking or bulging of veins distal to arteriovenous crossing. Now you can see this is the retinal artery and this is the vein. You can see bulging of veins distal to the arteriovenous crossing. Bulging of vein. This is Bonnet sign. Third is Gunn sign. Tapering of veins on either side of arteriovenous crossing. The underlying vein is concealed. Now this is retinal artery and these are the veins. You cannot see the deeper part of the vein because of the thickened retinal arterial wall. And the veins are tapered on each end of the on each side of the retinal artery. This is Gunn sign. Now the flame-shaped hemorrhages. Here you can see flame-shaped hemorrhages. These are flame-shaped hemorrhages. These are the ruptures of superficial capillary bed. As a result, blood disperses in retinal nerve fiber layer. Because of arrangement of nerve fiber layers, these hemorrhages become flame-shaped. So these hemorrhages are situated in the retinal nerve fiber layer. Next feature, cotton wool spots or CWS. Now these white fluffy lesions on the retina are called cotton wool spots. These are flame-shaped hemorrhages and white fluffy spots are cotton wool spots. These are due to capillary closure or rupture causing ischemia. Grade 4. There are 3 features in grade 4. All the signs of grade 3 plus macular star and optic disc edema. If these 2 features are also present, then it is a case of grade 4 hypertensive retinopathy. Grade This is normal fundus. Now next is macular star. Deposition of lipids and proteins in the macular area from the characteristic macular star. This is macular star. A star pattern because of the arrangement of fibers in the outer plexiform layer. This star pattern is due to arrangement of fibers in the outer plexiform layer. This is macular star. Now, how macular star is formed? This is due to leakage of the disc capillaries which extend into the macular area along the plane of the outer plexiform layer. When serous component of the exudate is absorbed, then only the residual lipids and the proteins will remain accumulated, which form the macular star. You
सर
can
सर
see
काइंडली
clearly
स्क्रीन
this
शेयर
is
कर दें
macular star. जी
सर काइंडली स्क्रीन शेयर कर दें सर आपकी स्क्रीन शेयर नहीं हुई प्रेजेंटेशन जो अभी
अच्छा कैसे करेंगे नहीं हो रहा है ये
सर शेयर स्क्रीन का बटन आपके सामने होगा सर शेयर स्क्रीन ग्रीन
नहीं है
कलर
ना ग्रीन कलर का नहीं आ रहा है
सर वो जो नीचे सर ऊपर की तरफ या तो आ रहा होगा देखें जहाँ मैनेज पार्टिसिपेंट्स लिखा हुआ होगा चैट और उसके
नहीं वो
बराबर में
पूरा नहीं
शेयर
एक्चुअली जी ये नेट जो ऑफ हो गया था ना तो
जी जी
दोबारा ये कनेक्ट हुआ है अभी नेट ऑफ था वो पहले
ठीक है सर वो होता ही है कि आपकी जो स्क्रीन है ना वो सर उसको उसको बड़ा कर दें सर मैक्सिमाइज कर दें सारे ऑप्शन आपके पास व्यू हो जाएंगे आपने जो सर जूम एप्लीकेशन खोली हुई ना इसी में ऑप्शन आ रहे हैं सर नीचे नीचे आ रहे होंगे ऊपर की तरफ आ रहे होंगे
वही तो मैं देख रहा हूँ क्यों नहीं आ रहे ना नीचे आ रहे हैं ना ऊपर आ रहे हैं
सर क्या कौन से ऑप्शन लिखे हुए हैं आपके सामने कोई ऐसे कुछ
कुछ
लिखा
भी नहीं आ रहे हैं ये कोई भी चीज नहीं आ रहे हैं या तो दोबारा से करूं मैं
सर देखें ऊपर की तरफ ना एक राइट साइड के ऊपर कुछ बना हुआ होगा एंटर फुल स्क्रीन लिखा हुआ होगा कुछ ऐसा या कोई स्क्वायर बना होगा या बॉक्स बना होगा उस पर क्लिक कर दें
देखो सिर्फ ये जरूर आ रहा है एंड शो और ये सारी जो चीजें हैं
सर आप दोबारा
नहीं
कनेक्ट
हो
कर
रहा है
लें अगर सर दोबारा
दोबारा
कनेक्ट कर लें
हाँ ठीक है
जी
शेयर स्क्रीन को क्लिक कर रहे हैं तो नहीं हो रहा है ना
सर अभी होगा एक मिनट
जी
जी सर आप कीजिए आप शेयर प्लीज
So in the grade 4, there are three features. All the signs of grade 3 plus macular star and the optic disc edema. Grade 4 is called malignant hypertension. This is normal fundus. Macular star is the deposition of lipids and proteins in the macular area. This forms the characteristic macular star. And this star pattern is due to arrangement of nerve fibers in the outer plexiform layer. This is macular star. See also this, how this macular star is formed is due to leakage of the disc capillaries which extend into the macular area. Just have a close look of this macular star. This is macular star in the macular area. Next is papilloedema. Papilloedema means edema of the optic nerve head. This is optic nerve head, and you can see it is edematous. Papilloedema means malignant hypertension. Now, there are two types of malignant hypertension, early malignant hypertension and the advanced. You can see in the advanced, lot of hemorrhages, hard exudates, and the edema of the optic disc. This is advanced malignant glaucoma. Now, what complications can occur if hypertensive retinopathy persists for a long period of time? Ischemic optic neuropathy, retinal artery occlusion, retinal vein occlusion, malignant hypertension, which is a life-threatening condition, and increased risk of having stroke or heart attack. Now, the treatment of hypertensive retinopathy is the effective control of hypertension. If there is vision loss, then retinal edema can be treated with laser treatment or with intravitreal anti-VEGF factors. Now, just remember these two pearls, clinical pearls. If cotton wool spots are present, it means blood pressure autoregulation has been failed. In this situation, the diastolic blood pressure is more than 110 millimeter mercury. So, simple presence of cotton wool spots means autoregulation of blood pressure has been failed. If you see papilloedema, it means it is a case of malignant hypertension, and in this case, blood pressure is over 150 millimeter. Now, next topic is vitamin A deficiency. Eye changes and vitamin A deficiency. It is due to diminished intake of vitamin A in the diet, less than 3,000 to 4,000 international units, or due to prolonged diminished absorption of vitamin A. Ocular manifestations of vitamin A deficiency are called xerophthalmia. There are 8 stages of disease, xerophthalmia. Number 1, night blindness. Conjunctival xerosis, which is the patches of dry, lusterless conjunctiva. Here you can see patches of dry, lusterless, non-bettable conjunctiva. This is called conjunctival xerosis. Third stage, Bitot spots, which are raised, whitish, foamy, triangular patches on the bulbar conjunctiva. Here you can see Bitot spots. This is the third stage. Fourth stage, corneal xerosis, means cornea becomes dry and lusterless. This you can see cornea totally dry and lusterless. This is fourth stage. Next, early corneal ulceration or keratomalacia. In early corneal ulceration, you can see corneal ulcers affecting less than 1/3 of the corneal surface. This is early keratomalacia. Late keratomalacia means large corneal ulcers affecting more than 1/3 of the corneal surface. This is the large corneal ulcer. This is late keratomalacia. Seventh stage is called corneal scarring. It is due to healing of stromal corneal defects. You can see this is the child with corneal scars in both eyes. So this is the seventh stage of corneal scarring. And finally, xerophthalmic fundus. It is characterized by seed-like raised whitish lesions. Seed-like raised whitish lesions scattered uniformly. This is xerophthalmic fundus. Now, what is the treatment of vitamin A deficiency? There are three parts. Number one, local ocular therapy. Number two, vitamin A therapy. And number three, treatment of the underlying general disease. Now, local ocular therapy.
Cuma cai bagi binatang. Tama tak cado ni cuma binatang galun.
Local ocular for conjunctival xerosis, artificial tears, 0.7% hydroxypropyl methylcellulose drops. In the stage of keratomalacia, you prescribe antibiotic eye drops. Vitamin A therapy, it depends on the patient's age. If the age of the patient is over 1 year, then you prescribe 2 lakh international units of vitamin A orally. If the age of patient is less than 1 year, then you prescribe 1 lakh international units of vitamin A orally or 50,000 units intramuscularly. And treatment of underlying disease, if there is protein energy malnutrition or other nutritional disorders, then these conditions should be properly treated. Now, prophylaxis against xerophthalmia. In infants 6 to 12 months of age, 1 lakh international units orally every 3 6 months.